Hello, this is Mr. McMurray again. I think we were just talking about seminal vesicles about that time when it went out. But the seminal vesicle, like I said, is making what we call the seminal fluid, which is going to contain sugar and other nutrients, vitamin C and other things that nourish the sperm. So the sperm are coming down the vas deferens. The seminal vesicle is going to add the seminal fluid to it that helps nourish them, keep them alive. All right. And so that's kind of where we left off. All right. Now, next thing on our list probably as we're going down here would be the prostate gland. Notice it circles all the way around the urethra. Okay, that'll be important in a little bit. But as a reproductive organ, basically it makes a fluid that it puts into the sperm, secretes into the sperm that activate it. So it kind of turns them on, if you will. Okay, they're kind of dormant, and this turns them on where they're out active and ready to go. Okay, so it's kind of like the final touch, and that happens in the prostate gland. Now, other things that happen with prostate gland, as you get older, the prostate gland tends to swell. And as it swells, it starts to squeeze the urethra, so it gets thinner and thinner, and eventually may completely squeeze it. All right. Now, obviously, if it closes the urethra, then that's going to cause the urine to back up and go back. Eventually, it's going to go into the urinary bladder, may eventually start backing up the kidneys, so that's going to cause lots of problems. Now, to solve that, we would have to put our friend the catheter tube in through here, and that would allow the urine out. That's temporarily to get that done. Then to fix it, we can either, sometimes there are drugs that can take in, medicines that will help with that. Microwaves, shooting microwaves at it can cause it to shrink. Sometimes, just like the catheter, you could insert a balloon in there, very thin balloon, blow it up and make this open bigger, and then deflate it and pull the balloon out, and then hopefully it would stay inflated. And they can also use some types of radio frequencies that will incinerate if there's extra tissue around the sides that's causing it to close up the urethra. They can incinerate that with radio frequency. So all those can happen, various things. Now, another problem with the prostate gland is very often it becomes cancerous. Okay, and obviously that's going to be fairly serious, but prostate cancer compared to, say, pancreatic cancer or some other cancers is a relatively slow-growing cancer. And many people, guys, don't get it until very late in life. So if I'm, say, 70, 75 years old and I get prostate cancer, it may not become a problem for another 10 or 15 years. And so rather than treat it and have the radiation and the chemotherapy and all the side effects that go with that, doctors may say, hey, let's just monitor it. And if it doesn't get too bad, we'll just let it go, okay? Because the odds are you're probably going to die of something else first. Now, if you're, say, 40, 50, or 60 years old, then they might say, hey, we need to go ahead and do something, okay? Because obviously the sooner you act on it, the better it will work. Most cancers, the sooner you attack them, the better your chance of having a successful outcome are. But many times, older people get it, older guys get it, and they just let's just let it take its course because it's not going to, it's not worth the side effects and the of treatments and stuff like that. So let's just let it go. All right. Now, to find the cancer, the oldest way used to be to palpitate, which just means to feel through the rectum. So doctor put on the rubber gloves, put the finger up this rectum, as you can see, it'd be right next to the prostate, and he could actually feel or palpitate, kind of like women can do self-examination for their breasts, for lumps, for cancerous lumps and things like that. Okay. However, they have come with a blood test, which tests for a chemical called PSA, which stands for prostate-specific antigen. All right, it's an antigen or a chemical that's found and produced by the prostate. If you have cancer, it's going to produce higher levels of it. Okay, and so it's not as accurate as actually examining it, but much more pleasant for probably the doctor and the patient. And so basically that's usually how they do it now. They test for the PSA. Now, if they test for the PSA and it tests positive, then they may actually do a rectal exam to see if that's correct or not, to kind of double check it. Or they could do some maybe other ultrasound or something like that. But for the most part, they've kind of gone away from the rectal exam, at least on a regular basis, unless they think there may be a problem, and using the PSA test. All right, the next one is the bulbo urethral. Bulbo, just because it's a bulb shape, and urethral because it goes into the urethra. Okay, and this one actually makes mucus. This mucus is released, okay, One does two things. One, it kind of cleanses out the urethra, so if there's been urine and stuff like that, it kind of cleans that and coats that so that the sperm will not be exposed to that. And then also, when it comes out, it will also lubricate the outside of the penis, and that's partly what does that. Okay, and so this does not contain sperm or anything like that. It's just a kind of lubricant, and it's released before any sperm would be released or ejaculated. All right. A couple things. Semen. Semen is just a combination of the sperm plus the seminal fluid plus the chemicals that activate this, and eventually some of this mucus that comes from the bulbourethral. All right. So it's just sperm plus all this. Now, this particular mixture is fairly alkaline or basic, and this is important because when it goes in the female's body, the vagina is very acidic, and the acidity would either immobilize, which they couldn't swim, the sperm, which basically means they're not going to be effective, and or could also kill it. So this helps balance that out, neutralize it, and so it allows the sperm to continue on in the female and doing their job. All right. You have the ejaculatory duct here. You also have an internal urethral sphincter right up here, which we did not label. But these two things are like little gatekeepers and valves that make sure that sperm and urine are not in the urethra at the same time. Since they share it, the ejaculatory duct is going to open when in sexual intercourse and ejaculating, but the urinary internal urinary sphincter is going to close so that no urine mixes with that, and then vice versa. Most of the time, the ejaculatory duct will be closed, and so only the urine is going down through the urethra. So those two valves, if you will, kind of basically on-off valves, make sure that they don't mix. All right. Finally, you have the penis down here, which is what we call erectile tissue. Basically, this is very spongy tissue. If you look at all this shaded in area here, this is basically blood vessels. And basically what happens is there's lots of blood vessels, and if the blood flow is cut off to leaving the penis, or at least constricted so not very much blood leaves, then this fills up with blood and it causes the penis to become erect. All right. The glans penis is just the head down here at the bottom of it. Okay. Originally, it is covered by some flaps of skin called the prepuce, or it may also be called the foreskin. If you're talking about the foreskin, it's just for the record, not talking about their forehead. It's talking about this. And as babies, this is often cut off. This was in the Bible, it talks about the Jews. That was a sign that the Jews did this, whereas the other countries around them did not. Okay, and so it was kind of a mark of. In the Bible, talks about circumcision or uncircumcision. Okay, well, circumcision means you have this little ring of flesh cut off. Now they do it while the baby's young. I'm sure it hurts, but the baby doesn't remember it. Okay, it can be done to adults, but then obviously it's much more painful because you remember it and feel it. All right, but basically they just cut that prepuce off all the way around the ring off, and that is circumcision, basically. Like I said, you've done that while the baby is very young and still in the hospital. All right, if they do that. Technically, I mean, if you leave it on there, it doesn't intrude on anything. It does help protect it a little bit, but also, on the other hand, it can get things up in there and get infected in there. So it's kind of a trade-off either way. All right, that's about it. If you know everything that's in the pictures and you know the notes, then you should be ready for the quiz, and I will be sending that out. Have a great day.